Good morning. Good morning, Facebook. It's Bill Paravano, the knee pain guru. And today we're going to talk about Baker cysts. I got a question here that came in last night, and there's some things that I want to talk about in terms of like looking at Baker cysts, kind of how they form, what you can do from a medical approach. This is what doctors do in terms of eliminating Baker cysts, removing Baker cysts, draining Baker cysts, and things like that. And then looking at are those approaches really working, and is that a path you want to go down, or would you like a more natural approach, something that isn't non-invasive, that doesn't involve surgery or needles or things like that. So we'll get into that in just a moment. So if you're on this call, please like the video, share the video, like my Facebook page, as well as follow me, because I'll be doing these. These are going to be daily videos that we're going to talk about knee issues, arthritis, bone-on-bone, chondromalacia, Baker cysts, the dynamics around knee pain. And a lot of people are really stuck and frustrated in terms of they're not getting any results. They're going to the medical doctors, they're not getting answers. So this is another option, presenting another option. And it's ultimately up to you to choose, because it is your, this is your body. You have to empower yourself and understand that when you walk into a doctor's office that you control the decisions, and not letting the decisions be dictated by the pain that you feel, being swayed by the emotion of it and ending up with a surgery that you don't need, or a procedure that you don't need or want. That is ultimately up to you to empower you with that. So, with that being said, what is a Baker cyst? Layman's terms, like to really break it down, it's a painful lump that develops in back of your knee. Now this can go down into the calf. It can be right at where the knee bends. It could possibly be above the knee joint where it bends. But in essence, it's a big painful lump that develops. And I use the example of what a Baker cyst is, and think of it like a kink in the garden hose. So your body has this system called the lymphatic system. It drains the waste products out of your body, and it's always moving this lymph out of your body. And when we have tension patterns from sitting in a car too long, from sitting at a desk too long, walking too much, standing. There was a nurse that it developed after she was leaning over a bed. Her legs were locked straight, and she was helping a patient out of the bed, and then she started feeling the pain in the back of her knee. It develops as a result of a tension pattern in the body. Whatever you need to do, moving or whatever, sometimes there's tension patterns that lock in the body that inhibit the flow of this lymph around your body. So it essentially develops like I call it a kink in the garden hose. The kink means like if you're pulling a garden hose around the corner of a house and it forms that kink, you have pressure that builds up on one side of the garden hose, the kink, and then there's nothing coming out of the other end of the garden hose. And this is the very same thing that happens in your knee. You have this lymph that's supposed to be moved around your body to clean out the waste products by your movement. And if we have this tension pattern that's going on in your body, I got a low battery, so I'm going to fix this so we don't lose the connection. But the point of what I'm saying is that this kink that is in your leg, this tension pattern that gets stuck in your leg, what happens is it inhibits the flow of this lymph throughout your body. And in the case of a Baker cyst, this kink is developed in the back of the knee. So it builds up this pressure. So you have this lymph that's going into the back of your knee, but it can't get out. So you go to the doctor. You say, hey, doc, I got this pain in the back of my knee. It's swelling up. What is it? They diagnose it as a Baker's cyst. Great. No problem. We're all on the same page. Now, the medical model diverges at this point. They're looking at, well, how can we get this lump, this swelling down? So they look at it as, three different ways. One, they'll send you to physical therapy, which means you exercise in hopes that the Baker's cyst will drain itself. If you already have if it's painful in the back of the knee and you exercise a painful knee, it gets more painful. You know this. But their idea is that hopefully it'll drain. They can also look at injections, which means they would stick a needle into the Baker's cyst, and basically like a turkey baster, they're going to draw all of the lymph, the goop that gets stuck in this swollen cyst in the back of the knee, and they want to drain it out. Now they're hoping that after they drain this cyst, that it doesn't come back. Majority of the time, that cyst does come back because they're not addressing the kink. They're not addressing the tension pattern that is going on in the back of the knee that is causing the cyst to form to begin with. Another solution the doctors would suggest is to remove the cyst altogether, which would involve surgery. So you schedule a time to have a surgery, you go into the surgery, the doctor cuts open the back of your knee, and they remove this entire sac. They remove this entire fluid sac in the back of your knee, hoping that's going to address what's going on as far as the cyst in the back of your knee. Well, of course, that's painful. You're opening up the physical body to germs, bacteria, viruses, and things like that can actually get into the cyst. And you hear more and more about being in hospitals on how dangerous that is with a lot of the different viruses and bacteria that are resistant in hospitals. So that is a viable solution, and it has worked for some people. However, there are dangers that are involved with having a cyst removed via surgery. And those are great, and that's what the medical model, and remember, that is a business model, the medical model, to help you alleviate this pain in the back of your knee. However, if we understand what the nervous system is doing, what your body is doing to form the cyst to begin with, and we go back to the garden hose analogy, we can get a better understanding of how to get the body to relax the tension in the knee to allow the body to drain the Baker's cyst on its own. So going back to the garden hose example, you pull the hose around the corner of the house, it creates the kink in the hose, pressure forms on one side of the hose, and there's nothing coming out of the other end. What do? Well, if you pull it harder, you just make the kink tighter. It's not going to resolve the kink because you have a knot in the hose, and the tighter you pull, it makes more of a knot. What we want to do is, in order to undo that kink in the hose, you want to take the hose around the corner of the house, undo the kink, and then pull the hose back without the kink. That will allow the hose, the water, to come out of the end of the hose. And this is the very same thing that we could begin doing with the knee, with the tension in the knee that's causing the pain. So when we have a painful knee, the knee is holding on to tension. There's tension, there's restriction of flow of blood and oxygen and lymph in the knee joint. So by beginning to create comfort in the knee, what happens is we relax that tension pattern that will allow the lymphatic system to begin to drain on its own. So all these waste products are getting stuck in the back of the knee, forming this swollen lump in the back of the knee. Oop, hold on. Geez. There's a question. I got a question last night about Baker's cysts, and it is on my computer, and I need to read it and then answer here. So I almost lost it. Okay. Creating comfort in the knee relaxes the tension and creates the space that the lymphatic system will be able to drain, the body will be able to drain the cyst on its own. It's a very simple process. I actually worked with a client a few years ago out of Park City, Utah. He had a Baker's cyst that developed after an ACL reconstructive surgery 9 years ago now. And we worked 3 weeks. 3 weeks. And by the third week, we got on a call and he had no Baker's cyst anymore, which was very cool. Now, of course, that is an exceptional case. And I have worked with other clients that have Baker's cysts that have drained in. It takes longer at times. But the point of it is when we get the knee comfortable, one, it doesn't hurt. And that's the only reason we're really talking. And two, it allows the space for the Baker's cyst to resolve itself. So just wanted to keep that in mind. So now we are going to, I had a question. There was a question from a Stacy. She emailed in on behalf of her mom. She said, my mom just found out she had a Baker's cyst going on a month and a half now. It's causing her a lot of pain. The only thing that helps is resting her leg. She ordered compression bands and it helped some, but the next day, seemed a little worse, and it feels like it's moving to the side of her leg instead of right behind her knee and calf. We will be going to a rodeo in 2 weeks. She almost doesn't want to go because of the pain when walking. Any suggestions? Should she get it drained or shots? She doesn't have insurance until April. And like I said, those are the options. What we had talked about, what I had covered at the beginning of this video, is that there is the medical model has a very limited approach in terms of how it can address what's going on with the Baker's cyst. So by relaxing the tension in the knee, getting the knee comfortable, the Baker's cyst will resolve on its own. Most of the time, anyone who has knee pain does not care about the diagnosis if they don't have pain. This is a really important point. The only reason you're on this video, the only reason you would email me, the only reason you would talk to a doctor, the only reason you would interact with any of my programs is because you have pain. If the pain went away, you would go back to your life. So there lies the focus of how to address what's going on. Create comfort, the body will heal itself. Create comfort, get out of the way, and now the body will resolve the issue on its own. So, directly answer Stacy's question, unkink the garden hose. Create comfort in the knee. Allow the knee to drain on its own. Then you don't need the needles, you don't need the surgery, you don't need the painful physical therapy, because the only thing that helps is resting her leg. It doesn't make sense to exercise a painful knee and put it in more pain. That, like, logically, rationally, that's, like, insane. Doing the same thing over and over and expecting a different result. The key is create comfort. The nervous system relaxes. It creates the conditions so the body can heal itself and resolve itself. And then see where we're at on the other side of that. So, that's going to wrap it up for today. There isn't a whole lot more that I could share regarding Baker's cysts. If you have questions, ask them below this video. I'll see the replies on that. Head over to my website, thekneepainguru.com. Ask questions on my Facebook page. Get involved in one of my programs. If you're like, hey, this guy's got good stuff, I'd like to know more, go take my 7-day knee pain reduction challenge. That is actually on this page. The Facebook page. If you want to get in more, like if you want to dip your toe in the water, take the 7-day knee pain reduction challenge. If you want to stick your foot in the water, then sign up for my program, The Comfort Zone, which involves 11 stretches working with the knee joint. And it includes a time for us to speak about your knee, get you some help. If you want to go more into it, I have a program starting up. It's called Quit Your Quack. It's a 6-week knee pain relief program. Next one starts February 5th. 6-week program. We dig in deep. We do 2 of these Facebook Lives in a private group per week. You get access to all the videos in my members area, and then we get you help. We work twice a week for 6 weeks to get you out of pain, whatever you have going on. So, like, subscribe, share this video. Anyone you know that has knee pain, that is dealing with anything with their knees, I can help them out. Thank you so much. Bill Paravano, the Knee Pain Guru. Have a wonderful day. Enjoy. And we'll talk to you soon. We'll see you tomorrow on the next video.